Which catheter design do you use in your practice and why? In this video, we will discuss the differences between two different perineural catheter designs, and I will offer some pointers on which one may be better for certain indications and clinical circumstances. And to set the record straight from the top, we will discuss two catheter designs: the catheter over the needle versus the catheter through the needle design. And while there are several manufacturers of perineural catheters in this video, for simplicity, I will compare these two Pajunk catheter designs. But why should you watch this video? Using perineural catheters for analgesia requires skill and clinical management. Typically, the level of skill required for catheters is greater than using a single injection nerve block technique. However, there has been advances in technology to facilitate the insertion of the catheters, as we will discuss in this video. And when we asked NYSORA's community which catheter design do they prefer, catheter over the needle versus catheter through the needle, here's what 1.3 thousand poll takers thought. 52% of our poll takers prefer the catheter through the needle design, and that is likely because this design has been around for a long time, and more clinicians may be familiar with the way it functions. About 20%, however, prefer the catheter over the needle design. And again, some of the new catheter over the needle designs have been gaining traction by facilitating catheter insertion, but the clinicians may have not caught up yet with this new technology that facilitates catheter insertion. And finally, 20% of our colleagues did not have a preference or were not familiar with the differences between the two designs. As for the difference, it's quite clear. So let's take this back for a bit. For a single shot nerve block, the needle is placed in the desired location. So let's say that is an interscalene brachial plexus. The needle makes its way there. Local anesthetic injection is made, and that was it. But for the perineural catheters, however, the placement of the needle is only the first step of the process. So let's discuss the 5 steps for the catheter insertion. Step number 1, the needle needs to be placed in the perineural space. So if this is the brachial plexus and this is the cervical fascia, you want to insert the needle into the space where you want to infuse the local anesthetic. That was step number 1. The step number 2, you need to make an injection to confirm the needle tip placement. Step number 3, now the catheter is inserted through the needle or over the needle into that space. Step number 4, the needle is now taken out and the catheter is checked for the position by injection through the catheter so that we now know that the catheter is in the therapeutic position. And step number 5, the catheter needs to be secured to the skin. The catheter over the needle and the catheter through the needle obviously slightly differ in these 5 steps, but the principles are the same. But let's see what experienced practitioners who are familiar with these two Pajunk perineural catheter designs have to say on this debate. First, we will ask Dr. Christian Jessen from Aarhus University, Denmark, who spent a month at NYSORA's Europe during his PhD rotation, about his preference. So, catheter over the needle versus catheter through the needle design. What is your take?
In the old days, we used the catheter through the needle. Then we changed them into the catheter over the needle technique. And the reason for that was that we, for trainees and residents, we did find it much easier to learn them how to place them, because it resembles much like placing a single shot nerve block.
It sounds like as Dr. Jessen has a slight preference for catheter over the needle for its simplicity and ease of introduction, particularly when teaching or introducing the technique in clinical practice. But let's ask a couple more of our European colleagues who use Pajunk perineural catheters. Which designs do they prefer? What are the advantages of the catheter over the needle design?
Well, one of the most obvious advantages was the better placement of the catheter.
I think that's probably one of the reasons I first went across to use more catheter over needle technique, is because it's easier to teach. because I think with the Saldinger technique, or with sometimes to thread the catheter through the needle is quite difficult, and you know, I find that especially amongst with the trainees, there was a lot of kinking of catheters and catheters not threading far enough, or not threading, or the thread, or catheters going off in other directions, not the direction you wanted to go. So that's one of the reasons I moved over to E-Cath, because it's easier to teach, and the trainees find, because it's like, you know, it feels like an IV access cannula, they find it a lot more easier to handle.
As you could see, there are some preferences of one catheter design over the other, but here's what we know from the literature on these 4 specific technical aspects of the perineural catheters. Leakage resistance. In studies, catheter over the needle consistently demonstrates less leakage, which is an important in management and patient satisfaction. Catheter placement accuracy. The catheter over the needle technique is more precise, which may reduce the incidence of primary failure rate, incorrect positioning. Introducing catheters to clinical service, the catheter over the needle design facilitates its adoption in new services and fast-paced environments, such as emergency departments, because its technique of insertion is more similar to insertion of an IV line using ultrasound, a skill that is more widely available, so that transition from a single shot to the continuous catheters is easier. Reliability. Catheter over the needle features improved visibility of the catheter during the placement, which facilitates its use and adoption. However, the catheter through the needle, by being able to thread the catheter deeper, may have a lower incidence of secondary failure rate or dislocation of the catheters. In our practice at NYSORA, we use catheter through the needle design. This is partially due to the long tradition of us using perineural catheters for pain management, so we simply have not had a chance to transition to newer designs. In addition, catheter through the needle allows us to place the catheter deeper into the nerve sheaths, which may help reduce the catheter dislocations. Indeed, since perineural catheters have a tendency to dislocate from their therapeutic position, the practitioners should choose the catheter design where the secondary failure rate is the lowest in their hands. For instance, the Marhofer study reported that as many as 25% of femoral catheters may dislocate in the first 6 hours, even in skinny, healthy volunteers. Therefore, whatever gives you the lowest catheter dislocation rate and the highest accuracy in your hands should be worthy of switching to. In conclusion, I think that both catheter designs are effective in providing analgesia, but which one to choose for your practice may depend on your own clinical setup. If you are just introducing perineural catheter analgesia service, I would suggest that the catheter over the needle may be the natural choice for its simplicity and similarity to the single shot technique. However, where the expertise is available, a catheter through the needle may be a more suitable option, particularly when longer duration of indwelling catheter infusion is required. We thank Pajunk for supporting education in regional anesthesia and this educational video by NYSORA, but for more information about the catheter designs we discussed in this video, visit their website. But now back to you. Which catheter design do you use in your practice and why? Feel free to comment in the discussion section and share your expertise with NYSORA's community. Until next time.